So we're presenting our results from the BELLWAVE-001 study, 001 study, and it's basically the initial report of the phase 1/2 study of Nemtabrutinib, which is a non-covalent BTK inhibitor for patients with CLL, especially patients who have relapsed and refractory to 2 prior lines of therapy, including a BTK inhibitor and a BCL2 inhibitor. So this was a very highly selected high-risk patient population, and we are presenting specifically on the results of the CLL cohort, and there were other cohorts included in this large phase 1, phase 2 trial. Some of the important things about this particular trial was that patients who were treated with Nemtabrutinib had really good tolerability. The toxicity profile was very good. The incidence of grade 3 and 4 adverse events were very limited, and other than cytopenias, there weren't a whole lot of really bad side effects that we've seen. We did not see any cardiovascular issues. There was some hypertension in this study, but most of those were easy to manage, and patients did really well on this study. Coming to the efficacy side, obviously this was a preliminary phase 1, phase 2 trial, so a lot of patients had less than optimal dosing, but despite that, patients had a response rate of anywhere from 50 to 60% based on the different cohorts. Patients with prior BTK inhibitor, patients with both BTK and BCL2 refractory diseases. So across the board, the response rates were very encouraging. We also showed durability of responses in those patients who otherwise would not have access to a lot of good options, especially if they progressed after BTK and BCL2 inhibitors. So this is an exciting step for all of us in the CLL field. We have now access to another irreversible non-covalent BTK inhibitor, which is well tolerated and possibly an option in the future for patients who have failed both covalent BTK inhibitors and patients who failed BCL2 inhibitors. So we're very excited about it and looking forward to it.